But let me give you a little summary on what DISC is all about. DISC is basically recognition on how our brain works. We know, go back to high school biology, and remember that your brain has two hemispheres. It has a right hemisphere and a left hemisphere. The right hemisphere is where the creative side of our personality lives, the right side. And that's where, we do things artistically. Naren, have you ever met even a younger child that can draw very well, or maybe they can just pick up a music instrument and actually make pretty sounds, is very young. Or maybe they can dance. Those are all the artistic sides. You ever met anyone like that, Naren, as a young child that could do the artistic stuff seemingly natural?
Absolutely, Gary. Yeah, I have met, some kids who are definitely very creative and very artistic. They'll draw, they do things with clay, and they're just almost gifted.
Yeah, they pick up a piece of clay, and next thing you know, they make something out of it instantly. It's like,
exactly.
Wow, it'd take me hours to do that. Yeah. Those people would be dominant on the right side of the brain. The left side of the brain is where the details live, the analytical side, the detail side, the math side. So same thing here. Have you ever met a child that happens to be pretty good at math, or they love details, they love analytics, they love computers? Well, those people would be more dominant on the left side. Well, the D's, so DISC, are simply four ways to describe the different people we meet in the world, And the letter D, I, S, or C was created because it tends to be the letter in adjectives we use to describe that person. So someone that's a high D is a decision maker. They're a driver. They're very decisive. So high D. Someone that's a high I is an influencer. They love to, so I is influencer. They're also a people person. The high I is, now I know people person doesn't start with I, but it does accurately describe the I's. So the D's and I's are both on the right side of the brain. Let's go to the other side, the left side of the brain, the S and C. The S's are steady, stable, secure. Those are the S's. And then the C's, those are the compliant ones. Those are the engineers of the world. They're very precise. Many of the C's are actually engineers by their job, by their profession. If they're not an engineer, they behave like an engineer. Well, they're on the left side of the brain with all the analytical side. So here's how this relates to the conversation. When you have a patient that's a D or I, they don't need much information. They don't want much information. On the other hand, the S's and C's are the opposite. They need bucket loads of information. Bucket loads. If you're presenting an implant to an S or C, they'll be interested in how the titanium screw osseointegrates into the lower jaw. They want to know what the material, the tooth is that you're going to restore on that implant screw. They want to know how long it'll last and whether there's long-term studies. However, the D's and the I's, when you're presenting that implant, all they want to know is how long is it going to take, how much it's going to cost, and how's it going to look. So think about that for just a minute. So now when we're communicating with our patients about going out of network, the D's and the I's, by the way, you can identify these patients. Of course, we're not going to ask your patients to take the DISC test. I think we'd agree that that would be out of bounds. Wouldn't you agree, Naren? We're not going to ask a new patient, hey, you can be a new patient here, but we have to have you take this DISC test.
I agree. That's not a good idea.
That's out of bounds. I would like to do that, but that's asking too much. However, if you listen to those two episodes that I were put in the show notes on the Thriving Dentist Show, you'll have all the information you need to properly identify each one of your patients by their dominant personality style. By the way, you'll have above a 99% accuracy in identifying their disc type. And whoever answers the phone on a new patient, if they simply listen to the words that come from the new patient caller, and then observe the patient in the first minute in your office, that's all it takes. You can identify their dominant personality style to a degree of accuracy of 99% or above.